So we are now looking at the second part of this. So we always assess using the internal rotation. We looked at unlocking the iliopsoas restriction. Now we're going to look at these adductors, and this, as far as I'm concerned, is the piece of resistance in terms of unlocking the hip. It's the hidden gem. So sometimes it's Magnus, sometimes it's Longus, sometimes it's a bit of a blend of the medial hamstring and the adductor longus, the adductor magnus. So we're going to see where we play with Tom, but usually it is the adductor magnus that gets missed. Okay, so how we do this, once again, we just reassess. Obviously we've already unlocked a little bit of that hip flexor, so we've got a lot more range here. So the way that we do this is you're going to turn the hip once again into a little bit of internal rotation, about as far as they can go passively. Place it over the front of your hip, okay, and then we're going to bend from the knee up here. So what it's going to do is it's going to expose the adductor, okay, so the inner surface of the thigh. Once again, it's really great to see that Tom has shaved for me. So we've got adductor longus there, then underneath we've got adductor magnus, and it is in this area that we're looking at probably going to address clearing out. So longus, then we've got magnus, and then we've got the hamstrings here. Okay, so a little bit of Premax Essential. So give it a bit of a liberal, but not too much, okay? Because we need, and this is a great thing about Essential, it just has the right amount of grip for us, okay? So sometimes if we use the original, which is even more grippier, which is good with some people, it just doesn't give us enough like the Essential does, okay? So that's where you'll start to get the different understanding of the different blends. Anyway, that is in my experience. All right, so it's a really broad pressure across here. Make sure I rejig this, make the hips down there, okay? And even what you can do is you can bring the hip over this way and just assess the range of movement as well, because that's what we're going to come back to as well. Okay, like that. Okay, so broad, soft, fist. So we're going to come in, that's longus up there, we'll come down. We're going to lock in, so I'm going to pull all the tissue and lock it out there, and then I'm just going to glide along the length right underneath the adductor longus, along the fascia of the adductor magnus. Now the magnus is deep, so you're not actually going to be resting right upon it because it goes deep. All right, so down again, lock it in, and along that line of fascia through there. You can also pick up a little bit of the medial hamstring fascia as well. You're going to take it all the way up. And as you're doing that, you're taking the hip up into abduction and flexion at the same time, like so. Broad along there, like so. Okay, and then I come back, and then I reassess. Wow, it's actually really good. Your adductor loves that, eh?
Yeah.
Yep. And that does make a massive difference. Now, the interesting thing about doing this technique, and I've done this on Tom before, and especially with cyclists, is Tom obviously complains a lot. Well, not complains, but obviously he tends to get a lot of lower back restriction and pain. By unlocking this, just the adductor component, you can take a lot of that load out of the lower back. And a lot of people go, I don't understand how that works. Well, why? Well, I think it's because you don't realise how much the adductors play a role in that sitting position. Okay, so as I mentioned before on probably one of the other videos is, you know, if you start to fatigue through your hips, it's in your adductors that you're going to feel it first on a bike as opposed to your glutes. And that gives you a fair indication of how much it plays a role. Coupled with the fact that you're in flexion for a long period of time as well. So we'll work through there and up along. Now I can really start to feel that open up really well. So that's about as much flexion as I'm going to get out of Tom. And then back up like so. And we just work. Yep, look at that now. That's just, wow, that's fantastic. Just loves it. Yep, that's good. Okay, so that's adductor magnus, adductor longus. Okay, you're doing a passive release technique all the way up there, and you're unlocking that internal rotation. And then obviously we can follow up with some actual hands-on treatments for the QL.
So, if you even remotely enjoyed some of that content, please do me a favour and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthines.com. That's where we have all the comprehensive assessment treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.